Hi, my name is Beth and I'm an exercise physiologist, also known as an EP, working in the MQ Healthy Weight Clinic. So to address today's topic of staying active at every stage, I'm going to talk to you about infants and toddlers from birth to 5 years, childhood and young people 5 to 17 years, adults 18 to 64, seniors 65 plus, and I'll also talk to you about some special considerations, statistics, and share some resources with you. First, we need to understand some definitions and differences between exercise and physical activity. Exercise is a subcategory of physical activity that is planned, structured, repetitive, and purposely focused on improvements or maintenance of one or more components of physical fitness. Physical activity is any bodily movement produced by skeletal muscles that require energy expenditure with no purpose and no structure. Sedentary behavior is defined as sitting or lying down for various activities, including time spent sitting at work and time spent sitting while using computers, watching television, and for other leisure activities. So to infants, toddlers, and preschoolers from birth to 5 years, physical activity for young children mainly happens through unstructured and active play. Benefits of activity at this stage include weight management, strong bones and muscles, improving balance, movement and coordination, promoting mental, emotional and social well-being, promoting better learning and thinking, and reducing injuries. The overall goals here are to have active play, less time sitting, and enough sleep. So we want to encourage independence and appropriate risk-taking with supervision, such as walking on a low wall, building a cubby house, or climbing a low tree. For infants from birth to 12 months, we want a supervised floor-based play, at least 30 minutes of tummy time whilst awake, so moving arms and legs, reaching and grasping for objects, crawling with obstacles, pulling up to a standing position, and walking and moving while holding on to things. For toddlers 1 to 2 years, we want at least 3 hours of physical activity each day, spread throughout the day, not in one time block, and things may include running, twirling, jumping, dancing, or skipping. And for preschoolers 3 to 5 years, again, 3 hours of physical activity each day, spread throughout the day, running, kicking, throwing, jumping, dancing, and skipping. We want to limit time sitting or being restrained, so avoiding sedentary screen-based activities, rather spending quiet time reading, storytelling, or doing puzzles and activities that support development. No screen time for children under 2 years, and no more than 1 hour per day for those aged 2 to 5. Long periods of sedentary behavior and using screens unsupervised can lead to developing language skills later, having shorter attention spans, harder to learn and read, and making poorer decisions. And good sleep, well, we need good bedtime and sleeping habits, such as a calming bedtime routine, consistent sleep and wake times, avoiding screens before sleep, and keeping screens out of the bedroom. For preschoolers, the aim should be 10 to 13 hours of good quality sleep. So children and young people aged 5 to 17 years, there are many social, emotional, and intellectual health benefits, such as fun with friends and family, reduced antisocial behavior, stronger cooperation and teamwork skills, better self-esteem and confidence, lower anxiety and stress, better concentration, healthy growth and development, strong muscles and bones, improved fitness, lower risk of disease, and a lower risk of unhealthy weight gain. So with regards to exercise, we want moderate to vigorous physical activity, at least 60 minutes each day. However, more is better. Several shorter sessions throughout the day is okay, and activities do not have to be organized or formal, can include football, netball, bike riding, scooters, swimming, or dancing. We also want to incorporate muscle strengthening activity as part of the 60 minutes per day, completed 3 days per week. Activities may include running, climbing, using monkey bars, push-ups, lifting weights, and yoga. We also want to include some light physical activity, several hours of light physical activity throughout the day. And activities may include walking to school, walking a dog or a pet, playing in the park with some friends, or some housework. We want to avoid long periods of sitting down, as this can lessen the benefits of being physically active. No more than 2 hours of sedentary recreational screen time per day. For good sleep, children aged 5 to 13 should be aiming for 9 to 11 hours of uninterrupted sleep, and for ages 14 to 17, 8 to 10 hours of uninterrupted sleep. Good bedtime and sleeping habits may include consistent sleep and wake-up times, avoiding screens 1 hour before bed, and screens outside of the bedroom. So to adults aged 18 to 64 years, the benefits of physical activity may include reducing the risk of type 2 diabetes and cardiovascular disease, managing blood pressure, cholesterol, and blood glucose levels, reducing risk of some cancer, preventing unhealthy weight gain and aiding weight loss, maintaining strong muscles and bones, and benefits in social and mental well-being. We should be active most days, preferably every day of the week. And to the specific guidelines for exercise, aiming for 2.5 to 5 hours or 150 to 300 minutes per week of moderate intensity physical activity, to include brisk walking, golf, or swimming, or 1.25 to 2.5 hours of vigorous intensity physical activity. So that's 75 to 150 minutes per week of jogging, aerobics, cycling, or soccer, or an equivalent combination of moderate and vigorous activity. And in addition to that, muscle strengthening training on 2 days per week, to include pushing, pulling, squatting, and using weights. We can use body weights, dumbbells, bands. You can do exercises at home or in the gym. So doing any physical activity is better than doing none. And if you're doing no physical activity now, start by doing some and slowly building up to the recommended amount. Building activity into the day is also recommended. So walking or riding short distances, parking 1 block away from your final destination and walking the rest, and using stairs instead of a lift. Again, long periods of sitting can offset the benefits of being physically active. We want to reduce the time sitting, so spending time walking during meetings or using a standing desk, walking during a lunch break. Just 4 minutes of movement every hour is recommended, and this may include marching on the spot, some star jumps, shadow boxing, walking when you're on the phone, or walking to the printer or a colleague as opposed to sending an email. Now to the topic of pregnancy. So there's benefits for activity for both the health of mum and bub. It can prepare for labour and recovery, lower the risk of gestational diabetes, lessen back and pelvic pain, lower the risk of incontinence, and better mental health, such as lowering the risk of postnatal depression. So we want to aim to meet the guidelines for adults for exercise. And just as a reminder, that's 2.5 hours to 5 hours of moderate intensity physical activity, or 1.25 to 2.5 hours of vigorous activity, or an equivalent or combination of both moderate to vigorous and muscle strengthening on 2 days of the week. Types of activity may include brisk walking, stationary cycling, swimming, dancing, and resistance activities. More specifically, pelvic floor exercise. And if you're planning to do vigorous activity, we need advice and supervision from a health professional. There are some changes associated with pregnancy as we navigate the trimesters, and this may include hormonal changes such as having an impact on ligaments and joint instability, glucose levels, and excess sweating. Weight and distribution and shape of your body may change. Center of gravity and balance will have coordination implications. Heart rate and blood pressure changes exist, and positional changes such as avoiding rapid changes and lying on the back needs to be considered. So some precautions that one needs to take include avoiding activity with high risk of falling or collision, avoiding heavy lifting. Now, resistance training is recommended. However, heavy lifting needs to be avoided, such as moving furniture. We want to avoid significant changes in pressure, such as scuba diving exercise. Monitor your pain and discomfort, staying well hydrated, avoiding exercise in hot and humid weather, avoid standing still or lying down for long periods, and wearing appropriate shoes and supportive clothing. A few more important notes over here. Don't start any new exercise during pregnancy. With regard to returning to activity, it's variable for every individual. Graded return to recommended levels is generally safe after your 6-week postnatal health check. And always get doctor's clearance. So to older adults aged 65 plus, the benefits of exercise include reduced risk of health issues such as blood pressure, cholesterol, glucose, and bone and joint health, healthy weights, reduced risk of falls, improving energy and sleep, reducing stress and anxiety, improving concentration and mental health. Some physical activity every day, and at least 30 minutes of moderate intensity physical activity on most, preferably all days of the week, to include walking, swimming, golf, aerobics, cycling, gardening, mopping, vacuuming. Strength training, such as resistance training at home or in the gym, lifting and carrying, for example, groceries or small children, and climbing stairs. Flexibility training may include Tai Chi, bowls or stretching, and yoga. Balance training can be static, so stationary, for example, standing with one foot in front of the other or on one leg, provided you feel safe to do so and there's something to hold on to, or dynamic balance exercises such as stair climbing. We want to reduce the time spent sitting down and building activity into the day, such as doing exercises while your kettle's boiling or adverts during TV. And 2 very important exercises for older adults include sitting and standing from a chair and going up and down on your toes. So now to some specific considerations across the lifespan. And these may include, for people with heart disease, diabetes or asthma, focusing on moderate intensity activity. High intensity is generally safe, however with some considerations, so always see an exercise physiologist. Strength training, particularly large muscle groups, and for those with diabetes, consistency of exercise every second day rather than consecutive Monday, Tuesday, Wednesday, and not Thursday, Friday, Saturday. For those wanting to achieve weight loss, a minimum of 300 minutes a week of exercise, moderate intensity physical activity with dietary intervention is recommended. And for those going through cancer treatment, various forms of treatment and associated side effects can be assisted through exercise, such as symptoms of fatigue, nausea, or neuropathy for those going through chemotherapy. In musculoskeletal, this refers to bones, joints, muscles, ligaments, and tendons. For those who have arthritis, low-impact exercise is beneficial, such as hydrotherapy or swimming, and then high-volume, low-intensity strength training. For osteoporosis, anything weight-bearing, such as walking or jogging, as well as strength training activities. For those who have had an orthopedic replacement, such as hip and knee surgery, well, you need to follow specific surgeon protocols, physiotherapy for early stage rehab, and ongoing strength and conditioning exercises. And a note here on medication, there's always an interaction with exercise. For example, heart rate, blood pressure, sugar response. Side effects of medication can also be treated with exercise, such as weight management, muscle pains. Always be sure to check with a doctor or an exercise physiologist. So a few statistics now. This was in 2022. Almost 1 in 4 people aged 15 years and over met the physical activity guidelines. That's 1 in 20 young people met the guidelines. 1 in 5 adults aged 18 to 64 met the guidelines. Half of the adults aged 18 to 64 described their day at work as mostly sitting down. And only 1 in 3 people aged 65 years and over met the guidelines. Nearly half the people did walking for exercise. 3 in 10 completed strength exercises, and 1 in 5 people engage in vigorous exercise. Physical activity is the 9th leading preventable cause of ill health and premature death, responsible for 2.5% of total disease burden in Australia. And physical inactivity contributes to 5.2% of total deaths. As you can see in this table, there's a summary of the physical activity guidelines and broken down into age categories and specifics for physical activity, strength training, and sedentary behaviour. As seen in the table on the screen, a sample program with progression can be applied to any activity. With just 5-minute increments each week, you're able to get to the recommended guidelines of activity in just 6 weeks. ESSA, the Exercise and Sport Science Australia, has lots of resources, particularly the Exercise Right page for chronic conditions. I would encourage you to have a look at that. And one final note, remember to always get clearance from a GP and see an exercise physiologist for specific advice for you and your health conditions. So thanks for tuning in. I hope you have learned something new.